Hey everyone, welcome to the webinar today. Thank you so much for joining us. We will be chatting about a topic that's on everyone's minds for about 25 minutes. Perhaps you're on your lunch break, or depending on your time zone, maybe a coffee break in the morning. And we're going to see what two of these wonderful organizations in this space are doing to mitigate the challenge that is today's topic, which is when event staff don't want to people anymore. We know events are happening and many of them are hybrid now. Many staff turned over or took on additional roles during the pandemic. So we're going to turn to these two leaders to hear what they're doing and to hear from Otis to hear what psychologically may be happening. So again, thank you for joining. We do have Kathleen Hayes, who's the VP of Revenue Operations at the American Diabetes Association. And we've got Molly Riley, who's the VP of Volunteer and Donor Engagement at Cystic Fibrosis Foundation. And as always, and lovingly, we've got Otis Fulton, the VP of Psychological Strategy here at Turnkey. So we're going to get right to it. I want to hear from our speakers today. Please be engaging in the chat, ask questions or commiserate or just share stories that are happening out in your event season, because we know it is end of April. Hopefully your events have kicked off really well this year in 2022. So without further ado, Kathleen, can you tell us what's going on over at ADA and what you're seeing?
Sure. Thank you so much for inviting me. I kind of have to go back a little bit and think about when COVID really first was hitting here and everything was shutting down slowly but surely. And I remember at that point in time, waking up one morning thinking, this is the first time that we're having this experience. Everybody around the globe is having the same exact experience, so it was very odd feeling of having to be remote. And shortly after that time, the ADA did make a decision to go fully remote moving forward. So we did close offices and our staff did have their home offices instead, and we're going to maintain that model. So we're kind of navigating that space a little bit over the past 2 years. I know Molly has a little bit of a different view as to what they're doing. But now that events are coming back in person and our staff is gathering together, I think we all again have this shared experience of that hesitation and a little bit of anxiety to getting back in person. So validating that across our team is very important to the ADA.
Awesome, thank you. All right, and Molly, how about you over at CFF?
Sure, thanks. We've made the decision not to be a fully remote organization. So we are a hybrid organization, meaning that we will have, we do have a fair number of people who are remote, but we will maintain office space as well, and people have the opportunity to go in and out of their offices as well as working from home. And back in 2020, when we made the decision to start rolling back events, and then everybody went remote, that was a big pivot for us, and it gave us an opportunity to really experience what people living with CF experience, every day, and how they attend their events. And because of the nature of the disease, people with CF are limited into the in-person events that they can attend. So it gave us a real opportunity to experience on a very small scale what it's like to be a person with CF. And we enjoyed participation from our community in a way that we haven't experienced in many, many years. And so we've made the decision where it's appropriate that we will incorporate a virtual component into our events in an effort to be able to maintain participation and a feeling of inclusiveness for our entire community. And we understand that's not possible for every event. It's hard to incorporate a virtual component into a golf outing or a walk, or I'm doing our extreme hike this weekend. It's very hard to participate virtually day of, but we are working really hard to figure out what that hybrid experience looks like. So it's given us an opportunity to reimagine the way we have done our work, and we're committed to that approach. So it's new and exciting times.
Yeah, absolutely. And I'm so glad you guys touched on it's not just where the events are happening in person, but it's also where the office is and what the expectation is of working. And I've also heard from several of our folks in our alongside groups, I don't want to say clients, but people from the industry at large, saying like boards as well, same challenges, and maybe some fatigue, and where do we do this in person? And then a whole lot of people have formed new teams, and this might be the first time that they're meeting each other in person. What is that like? What's the rapport? So could you guys both chime in with things that you guys have done to help support maybe your event staff or your employees in general to coming back to in person? What are some new things or oldies but goodies that you brought back that you didn't expect?
I'll jump in. I'll touch on something that Kathleen said, and the acknowledgement that there's some anxiety around going back to work, going back to an in-person event is real. Not for our staffs, and I experienced it myself. Not that long ago, I went to an event with 600 people. It was the first time I had been to an event with 600 people in close to 3 years. And driving to the event, I did have some anxiety about being around a large number of people. And then once I got through the registration, it felt very familiar and felt very, I felt a lot more comfortable. And so it was sort of the anxiety of doing something I hadn't done in 3 years, and just giving our teams space to acknowledge that anxiety is really important, and validating it, and giving people room to slowly get back into in-person events and in-person work. So our office right now, we're in what we're calling optional return to work. And so it gives people an opportunity to sort of gradually get back. And we're going to go back sort of fully in person with hybrid options starting May 9th. But I think it's really important to acknowledge the real fear and anxiety, giving people space and opportunity to sort of name and claim that. And then we're easing people into returning back to the office, as well as in-person events. So acknowledgement and time.
Yeah, and I think putting people first is really important across here. Again, acknowledging that there is fear and anxiety, but it's also setting the expectation, even with new hires that come into this remote space, that even though we have home offices, the expectation is not that we're going to be solely in the home office, in your home office forever. You are actually part of a team. And how does that look and function a little differently in the remote space compared to when you have like a brick and mortar office? So we are navigating that, and our executive directors and leadership teams are looking at that as the new way to engage and communicate. You might be at a public space where you're working together, but it should be a cadence of in-person team meetings, so you can start to get that rapport between your staff. And the other thing you brought up about leaders and the volunteer leadership, one of the things that we definitely identified during COVID, we had staff shifts. Some of the volunteer leadership, I think, felt a little disconnected from the organization because they were definitely tied to certain staff at that time. And what we're incorporating now is bringing all of our leadership committees together and our leadership boards so they can meet as a group and be part of something bigger and connected together to our national board and our office of the CEO, and it really makes them feel like they are part of that bigger conversation, and I think that's really helped.
Awesome. Well, Otis, what do you think is going on? What psychologically is contributing to the feelings of anxiety?
There are a number of things, for most of us, almost all of us, our in-person social skills were dulled during the pandemic. And it's not just the face-to-face meetings that the pandemic eliminated, but it's all the behaviors that go with those meetings. In every single face-to-face conversation, we're unconsciously calibrating and judging our behaviors to make other people and ourselves feel at ease. And, we spent a year, almost 2 years, not practicing those skills. And so, I've heard a lot of people, and I've experienced this myself. You go to a meeting now, and boy, it's a 1.5 day meeting, and you're just exhausted. It's because these skills require practice, and we're out of practice, but they happen unconsciously, but they're still burning the energy. And it's the same thing with Zoom fatigue. Our brains are trying to gather a lot of information that we usually get from physical cues, and now all we can see is a face. And so it kind of goes into overdrive. So there are a lot of things that we need to kind of recalibrate as we gradually get back into seeing people face to face, because these these feelings of discomfort are very, very real.
Yeah. And I think especially for, a nonprofit professional, I'd like to, give a shout out to everybody who's in the space. Like, we work so hard to love on people and find out how they want to be loved on. And those skills as well, just times 100, it feels like to me. I've heard things like, I don't know how to make eye contact anymore. It's weird. Or my face feels weird to not wear a mask in person. Or I didn't even recognize you without a mask. Things like that are happening now, where people that we've come to be like intimately connected with on Zoom, we're having to reintroduce ourselves to in person. So
if I could add one more thing too, the
Yeah.
research, even pre-COVID, there's just a lot of research that says that people, they tend to underestimate the positive benefits of being with others. And I think that's continued, and it's kind of magnified now. There's a lot of research that says even talking to strangers, is a very positive experience for people, which is why I always talk to people in grocery stores. So I think that we underestimate kind of the good part and overestimate the bad part of getting involved with other people right now.
That makes a lot.
I liken it to, like, the peopling muscle. We haven't used it in a while, and just like, when I don't work out as much as I should, it takes a while to get back. There is muscle memory, but I think what Otis said too is it's what I was surprised about going to my first couple of events was just how tired I was when I finally left the event, and it's because it's a muscle that I hadn't used, and it really does take energy, and then there was that sort of awkward, you don't know if people are people hugging, how do people want to be greeted, so it's like trying to navigate sort of this new uncomfortable sort of world that we're living in right now, and it takes effort, but the good news is it's a muscle, and we do have muscle memory there. It does come back, just like riding a bike.
And I think, we're very comfortable now in this digital space. We're used to seeing people on camera. We're used to communicating through email and Teams and all of these tools, but the need for human connection is still really there, right? And that really, it also translates to our events. And I know, Otis, you and Katrina with Turnkey, that you've studied this a lot, but that human to human connection is very, very important, so even though we can communicate with participants through all these digital means, being able to meet with them, speak with them, in person in some kind of maybe new imagined way is really important.
Yeah, I would agree. I know we talk a lot about, communicating the impact of the fundraising dollar. And I feel like this is a tangible point to like the community that we're offering to people. It has a tangible value now that we're coming out of a pandemic, especially. And I think before, if we had said that out loud, we would have maybe scoffed and gone, yeah, but like, where's the cure, or where's the treatment, or where's the advocacy from that? But now I think we can all agree that human to human contact has a lot of value that we hadn't really attributed it to before. So yeah, thank you guys for that. We do have a question that came through. What are your reactions when event people don't want to do events? Asking this in an HR kind of way. If they can't do the job, what do you do?
It's a great question, right? And one that we're facing and likely will continue to face. And I'm not sure that we have the answer. I won't speak for Kathleen, but I think what our first approach is to really understand why, and to ask some probing questions. From our experience, a lot of the decisions to or hesitancy to go back to doing events is fear-based, and helping and understanding what it is that that individual is afraid of, or the concerns that they might have, helps us figure out the right next steps. I don't think it's a one-size-fits-all answer, but I do think that it takes some understanding of what's behind that the hesitancy or the decision to that they're uncomfortable with events.
Yeah, I agree. It's a case-by-case basis because everybody is individual. One of the things too to think about, which when we first started going back in person, having worked with some people for over 2 years, but they've never seen one of our events in person because they were new 2 years ago. So that is, I think, in a lot of nonprofits, that's a space we haven't been in yet. A lot of people have seen events. So that fear of the unknown and what's expected for the event is something that we try and communicate out so that expectation can be visualized.
Yeah, that is something that I've heard from others in the space as well, is that they had beefed up the travel budget for national staff to go to more events. And then here we are with the gas prices as expensive as they are. The first, 2% of events of the schedule for the year have blown the whole budget, unfortunately, because of gas prices. So there's a lot more than there already was of sending folks to other organizations whose events are closer in order to save on those costs and still get that in-person event experience. I also have a client who made a silly checklist for her new event staff and volunteers to just remind them what to take to event day. Like, don't forget your phone charger. Like, we haven't talked about it. I've missed packing certain things. We had an in-person event ourselves at Turnkey. I didn't pack a couple of things that I normally pack every single time. I forgot. So I think that there are some fun ways to build that rapport back up, to get people ready for event day. I'd love to hear in the chat if you guys have anything that you've done at your organizations, any stories that you have of a volunteer or a staff person or a fundraiser coming into an event, good or bad. Any stories that you guys have to share, we'd love to see them in the chat.
And let me just say in the meantime, and I think it's so important to have this kind of conversation that we're having right now with your staff and say, hey, this is a real thing. And, it's going to require stepping out of your comfort zone, and different people are going to take it at different speeds. And what was comfortable to you before the pandemic may not be comfortable now. And that's not unusual, but it's going to take people getting out there and interacting in these smaller steps to get back to, as Molly says, exercising that muscle memory of peopling.
Kate, I would also add that we are supporting our managers and our executive directors with some management training around adaptive leadership, because it is not a one-size-fits-all world that we live in. It never was, but it even less so now. And really, we need to put our people first, and it's a reminder of our commitment to our managers and to our people. So we've increased our support around management training and really leaned into adaptive leadership and pulling away from managing to policy.
Fantastic. All right. So the last question I'll ask you too. So in spite of the peopling being harder and more tiring than before, what's the fundraising, the revenue looking like? Are the dollars coming back, even if the people maybe are hesitant to be in person? So can you just give a high level of what you're seeing?
Yeah, we've had a couple early events in March, and one that just finished a couple weeks ago. And, we're seeing the numbers of participants are less than what we estimated. I think the early events were also dealing with COVID in January when everything hit and all the variants. So, but the participants who are coming back are passionate participants that are fundraising. They have stuck with us through COVID, and our revenue numbers are looking good.
I agree, Kathleen. We are cautiously optimistic with the early results. We've seen, I think, more people perhaps giving less, but our numbers are good, and they are directionally correct. So we're feeling very positive going into the third and fourth quarter, and yeah, I think we've spent the last few years really focused on supporting, connecting, and engaging our community base, and I think that has paid off as well.
Mm-hmm. We just had a couple more questions come through. So some of our folks are leaving for different jobs that are more like the lifestyle they had in COVID. Do you guys see that happening as well?
I can't really speak to that, not knowing, some of our staff who have left the ADA. I mean, we are fully remote and flexible with that, so I really can't speak to that.
Yeah, we haven't seen people leaving for that reason. We have a hybrid work model, so, and we really are, we're really committed to people's health and well-being, so and flexibility. So I can't really speak to that either. We see people leaving for life changes, not because they don't have the same lifestyle that they did during COVID.
Got it. All right. And then the last question, how has the experience been for guests and participants attending your in-person events? Is anything being done for that audience to ease them in, new guests versus legacy? So is there any kind of veteran treatment versus new person treatment coming to the events?
I think for us, it's the lead up to the event day, that's really important. So those legacy participants are getting the stewardship throughout the campaign, and kind of like having that VIP treatment of, you've stuck with us through COVID, and you're here for this event. The whole atmosphere at the events that I've been to already, it's very much, people are happy to be back in person. They're excited to be there. The energy is there. It's really, Molly, you said you had your anxiety going to your first event. I felt the same going to ours. It's like, I'm going to be around 1,000 people. That's not what I'm used to, but once you're there, it really was great.
During COVID and virtual campaigns, we really elevated our campaign ambassadors, and that worked very well for us. And so we are continuing with that ambassador program, which provides, I think, a great sense of sort of welcoming, and there's a face to the event and to the campaign, and so it's a peer-to-peer connection. So that's worked well for us. And, I would agree, Kathleen, I was at an event in Chicago, and people were just so excited to be back together and to share stories about, how well their loved ones are doing. There was just, you could feel the energy in the room, that it was good to be back together in person. Now, we always have, masks available if anybody's uncomfortable, and, we're cognizant around, spacing. And so we're trying to make it, as safe and welcoming for everybody, wherever they are in their personal journey with going back to in-person events.
All right. We did have a question come in about requiring vaccines. That really is organization specific, and even sometimes city specific. So we won't get into that, but I'm happy to offline that question at any time. We also had another question. We can each take 30 seconds to answer, if that's okay. We're going to blitz this one. You mentioned that attendance wasn't what you anticipated. How did you plan for attendance to be? How did it compare to what you planned for attendance, or what attendance actually happened in 2019?
Yeah, compared to 2019, we were really estimating about probably half the participants returning, just, over the course of the past couple of years. So given that, we were probably, 25% off of that. So, which was still a really good number. But yeah, that's how we kind of set our goals.
Okay. Molly?
I would say that right in line with our thinking as well. We've had some events, it increased. We were surprised and more people attended, and at other events, less people attended. But I think we planned for about 50% less than 2019.
Gotcha. And then really quick clarification, Molly, from your share, what are campaign ambassadors, volunteers or staff?
Volunteers. That's a great clarifying point, volunteers.
All right, everybody, thank you so much for joining our webinar today. Thank you, Molly and Kathleen and Otis, for joining and sharing what's going on in your worlds. You're the best.
Thank you.
Take care.
Have a great day, y'all. Bye.